one of the strategies that I took to learn some of the clinical components of IP as a non-nurse is leveraging the skills and expertise of the individuals that I'm working with, right? So if, say, for example, if I'm amongst a team of IPs and there isn't a nurse on that team, I will definitely partner with a nurse leader and or a bedside nurse and take the time to round with them. When it came to learning, say, for example, central line and urinary catheter audit, I definitely rounded with the nurses and nurse educators to learn about these devices, these indwelling devices, and assess what are the aspects of, an audit that I need to ensure that I'm successfully executing. What are the things to look out for, even as it relates to the patient's symptomology and their condition. Really, this is not something that a profession that you can, I don't believe that you can, do it alone. Definitely build your network of individuals. And if you're a solo IP, reach out to other IPs at other organizations, leverage the expertise of the nurses that are there, the CNAs, and whomever that's willing to be a teacher. Handling it from the approach of displaying a questioning attitude, and not being the IP police or anything such as that. My position when during that time in which I was learning the clinical aspect, I was very open and willing to learn and understanding that this person is the expert related to this. However, I'm bringing, my knowledge as an infection preventionist to ensure that we're promoting patient safety. And this is something that we're doing in partnership. So I think it is very integral to really partner with the clinical stakeholders, respiratory therapists and et cetera, to learn the clinical components and do literacy, conduct your literature review, read the articles in AJIC, the peer-reviewed articles as well, in order to learn how to navigate your role and the clinical aspects of it.